3 years into the pandemic, and it seems like everything's back to normal. Shops, bars and cafes remain open, as do nightclubs, and almost every other part of everyday life. Politically, Boris Johnson finds himself in a tricky position. Tory rebels could well undermine Johnson's leadership if he were to approve new, wider restrictions to tackle the Omicron variant. The blitz spirit of last summer has left, and now purely political squabbling over how best to proceed with this virus has taken its place. Government scientists have been calling for fresh restrictions since before Christmas, but ministers in that same government have had strong opposition to such thing. But away from the Westminster Zoo, there are real lives, real hardships, real stories. The health sector is still struggling both with COVID patients and the feeling that they're being undervalued by this government. We may know how to treat COVID patients, but dealing with the welfare of nurses on the front line is an entirely new issue. Staff shortages, pay and conditions are also problems facing the NHS as we enter the new year. Although many in the health service agree with ministers the need to live with the virus, they still feel more measures need to be in place to protect the NHS before that happens.
I think we know how to sort of deal more with COVID patients now than we did at the start of the pandemic. I think we have more of a plan these days of how to control the outbreaks on the wards, and it's a lot more systematic than it was at the start of the pandemic. But I think in terms of the nurses' mental health and things like that, I think we're still struggling just as much. I think maybe even more. We've lost a lot of nurses during the pandemic, so that's definitely contributed to staff morale and people being able to carry on as normal, really. But in terms of the actual workload, we know how to treat COVID now, and it's not so much everybody's really sick from it, so it's a lot more manageable in terms of that.
And then, so on the wider picture, do you feel, as a critical care nurse, do you feel forgotten by this government?
Yeah, definitely, 100%. I think the government, in the past 2 years, I've really evaluated sort of what the job I do, because it's so undervalued and so overworked, and the government haven't ever taken into consideration how it feels as for us as a nurse, just as long as we're there to do the job, and when actually they haven't looked at how many nurses have left in the last 2 years. I know so many people that have just left nursing completely, that have left critical care and don't want to work there anymore. So the staff base on critical care at the moment is extremely junior, because we've lost all of our senior staff members because it's because of the government and the way the government have treated us and the way the government have gone about, looking after us. There's been nothing really. There's nothing that they've done significant to reward us or thank us for what we've done for this past 2 years. So I think the government have definitely need to step up, but I've lost all hope in it, really. I don't think it'll ever happen. In the beginning, when it was all going on, we all sort of thought that we'd definitely get a pay rise, but there's been no thanks, really. There's been nothing that makes us think that we're, we've done a good job or that we're valued. As a nurse, you do nursing because you care, and I think the thing that is so frustrating is it's hard for us to sort of accept all of these, the government basically ignoring what's going on, because people are dying and people are suffering from this, and people are not, they're not surviving coronavirus, and the only way to stop that is for restrictions. But then at the same time, it's hard because I understand that we need to carry on. But I do feel like the government at the moment is very one-sided in the fact that I think they're more focused on just making the NHS, making the government, the UK government, survive than the people that live within that. Some things haven't changed. It's not some things completely haven't changed. And we're struggling in the NHS, not just for coronavirus. We don't have any resources because, nobody's giving us any money, sort of thing. And then you see that they're able to open up these big hospitals, but they don't have the staff to fill them. So I think a lot of what they do is just all to make it look like they're doing something, when actually, when you're on the front line, you really don't feel like they're doing anything at all to try and help us. So that's probably been one of the most frustrating things. And like we said, I do think a lot of staff have left because of that reason, to be honest.
So you feel that they're more concerned with saving their political lives rather than the citizens?
100%, yeah. And everything that you've seen with, recently with them all having this get together when we were all supposed to be locking down, it's just a bit of a slap in the face as a nurse, to be honest with you. It's a bit of a, it makes me wonder what they say to each other behind closed doors, basically, because we're all out here trying to do our best, trying to survive this mentally and physically as well, and the government are just completely ignoring everything that's going on, and it's really, really extremely frustrating, to be honest with you, as a nurse in the NHS. It's really hard to accept that we're under a government that don't seem to care at all.
Ministers are split over how best to proceed in 2022. Chris Green, MP for Bolton West, and one of the Tory rebels who voted against Plan B measures in December, feels that given the strong uptake of vaccinations, it's now decision time for Number 10 to decide whether to allow education and the health sector to run as it did before the pandemic. From the outset, the government said the vaccination programme is the way out of the pandemic, Green said. With 52 million first, 47 million second, and 34 million third vaccinations having been delivered, combined with natural immunity, we are in a far better place now than at the beginning of the pandemic. The government and health system need to make a decision whether to carry on with their current COVID policy or return society to normal so children can resume a normal education and vitally important elective healthcare can be delivered by the system. The hospice sector is also having to adapt what they learnt with previous variants to the new Omicron variant. Hospices in England have been relatively well treated by the government throughout these last 3 years, but staff are still finding it as hard as ever to adapt to reductions on visitation rules. The care that hospices give out has always been closely woven with the families of patients, but COVID and the new variant has put a stop to much of that.
So in terms of the government's support, we were very pleased at the very beginning of all of this that the membership body, Hospice UK, managed to broker a deal with the government for some support for independent hospices. And what that meant was that there was money allocated to the hospice sector in return for offering up some capacity of beds to the NHS when required. So that's what helped a lot of hospices through the first wave. Now, with the Omicron and the current situation, it's just a nuance of that, really. It's not as severe for hospices, but it's the same. It's a different version of the same principles that were severe a couple of years ago. The one thing that has affected our staff, and this will be the same for all hospices, is the restrictions that we've had to put on visitors. For example, in normal times, pre-COVID times, the philosophy of St Anne's Hospice and all the hospices is anything goes. Generally, no visiting hours. Generally, the car parks are free. Generally, you can eat when you want. Generally, you can bring as many people in as you want. Sometimes you can bring your pets in. We've had donkeys sticking their head through the window when people need some support from their normal life. So all that had to go. So what distressed our staff, certainly our clinical facing staff, was the fact that we have had to severely restrict visitors to come and see the people they love at this very difficult time. And that has included when people are dying. We have had compassionate opportunities to relax the rules, but essentially, instead of anything goes, come as you want and we'll help you out, it's been one or two or three, depending on the circumstances, nominated visitors. So that's really affected hospice staff, because normally we get very much involved with the families.
Plan B measures are expected to be in place until at least the 26th of January. And speaking in the Commons last week, Boris Johnson said that we're experiencing the fastest growth in COVID cases we've ever known. Johnson must now straddle between keeping the country healthy and not angering those in his cabinet, like his Chancellor Rishi Sunak and rebels on the backbenches, by approving new restrictions that may harm the economy. With a general election in 2 years' time and potential leadership candidates already pruning themselves, it's vital for Johnson to win NHS support, whose doctors and nurses in Manchester and across the country have felt betrayed and ignored. The ceremonial clap for carers has worn thin, and those on the front line now want a clear promise for the future, that the NHS will not be hung, drawn or quartered for the highest bidder as the country tiptoes its way out of this pandemic.